Hi, everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today and HitMic, and we're excited to bring you another series of interviews with top leaders in healthcare marketing. And our guest today is Beth Friedman. She's a senior partner at Finn Partners. Welcome, Beth.
Hey, John, thanks for having me.
Yeah, I'm excited to have you on. Obviously, we have a decade plus relationship. You're a longtime sponsor of HitMic along with Finn Partners. So appreciate you coming on to share some insights and perspectives as we kind of look forward to the next year. But before we dive into that, tell us a little bit about yourself.
So, as you mentioned, I'm a senior partner at Finn Partners. I'm based in Atlanta and kind of head up our healthcare IT group here at Finn. But before I joined Finn, I founded Agency 1022 in 2005. And I think that's probably when you and I met, was just shortly thereafter. We became part of Finn Partners last year. So that's a little bit of my professional background. But I got to tell you, my healthcare expertise really comes from my decade in the hospital, and then a decade after that spending with health IT vendors, who I know are a lot of our folks at HitMic and a lot of people listening in today.
Yeah. I think that's something that makes you special, is you actually worked in a hospital, kind of like me. I actually worked in a medical practice. It changes your perspective. So tell us a little bit more about Finn Partners for those that don't know Finn and what they offer.
Of course. So Finn is a global PR and marketing agency, and we cover all sectors of technology, health, travel, pharmaceuticals, education. Really, there's just a plethora of different types of marketing and public relations we do. But I will tell you, the healthcare group is one of the largest groups at Finn. We have several hundred folks across the world and across sectors. So obviously, I'm involved with the health IT piece, the digital health piece, but we have marketing and PR professionals in pharmaceuticals, medical devices, even provider marketing. Yeah,
it's quite the breadth. Obviously, toward the Finn Partners Israel, which is another important part of Finn, which is an amazing, the digital health that's happening there. Well, let's dive into the topic today. As you look back at 2022, before we look at 2023, what is your biggest takeaway from healthcare PR?
Yeah, absolutely. I've actually got two that I wanted to share with the audience today. I think that one of the ones I saw was media really wanting more proof points. So during COVID, John, we've seen a lot of digital health startups. We've seen a lot of new technology being adopted. I think you wrote about that last week. You blogged about some of the digital transformation. All those companies really, it was a hockey stick, right, the past few years, because we were all trying to find new technologies to support that virtual remote care delivery mechanism. And so we're a few years past that now. So I think what we're looking for now is really proof in that. And this was confirmed by a report that Finn did, actually, with Galen Growth Partners. We announced that report back at HLTH at Health. And so the investment community, as well as the media, editorial, journalists community, they're really saying, okay, with all these new digital health tools and applications, where's the proof, right? So show us how it's delivering on either clinical effectiveness or reducing costs of care to address some of the financial burdens we have in healthcare today. So that's the first one. Okay. I think I'm saying.
Yeah, and the second.
Yeah, so really, again, that drive for the proof concepts. It's great to have a disruptive idea, an innovative idea, but I think this year we're getting back to like, okay, well, where's the results? What are the outcomes? The other thing I think I saw a trend, and I'm sure you'll concur with this as we're sitting here right now on a video recorded call, video segment, is really the improved accessibility of media types. So more types of media to accommodate different audiences. I think any savvy PR marketing person in our industry is looking at every single piece of content that they have and figuring out different ways to display that and share that, different formats, video, audio, curated, social groups. No one piece of content can really stand solo now. It really needs to be digestible by all types of audiences. And I see obviously the publications and the media looking for the same thing.
Interesting. Yeah, I mean, I think there has been an explosion of the repurposing of content, which is a topic we've talked a lot about at HitMic, right? But around video, around audio, around different formats. Social is different, even social video versus YouTube, et cetera. So it's been quite the evolution.
Yeah,
How
it
about
has.
looking forward for 2023? Can you give us maybe a prediction for what health IT companies need to know about PR in 2023?
Happy to. Health IT companies are our clients. We work with lots of them, and we've learned a lot over the years, and we're always happy to share what we've learned. I think the first thing to really best practice, always integrate your PR and marketing together.
Mm,
A lot of companies don't do that. We work with some that keep them very siloed, and I
interesting.
think that's like a tragic mistake.
Isn't it
There's
easier said than done, though? I mean, it's I don't know. Do you see it as easy to integrate the
Yeah,
two?
I think it all boils down to target audience, right? So let's narrow on that for your marketing campaign, and then figure out from an earned media perspective, how can we get to that target audience with whatever you're trying to do in that quarter with that campaign, right? Whatever the topic is. No, I actually think it's pretty effective. We try and encourage a lot of our clients to do it. And I think it's just a strong collaboration that needs to occur. And hopefully we'll see more of it in the year ahead.
Yeah, I mean, it would make sense to have those synergies.
Yeah, for sure. I mentioned the need for the proof points. So, PR and marketing people out there, please, please, please keep looking for those that we can get to our media and journalist friends and peers, because that's really going to go a long way in our industry. Something, John, that's really been bubbling up, and my background is in medical records. I think you know that, and I worked in HIPAA, and I worked in data and analytics in the hospital and with vendors. This whole thinking again about patient privacy again
Hmm.
and looping that back in. So Stat had an article yesterday, and it quoted a report they did. They looked at 50 consumer telehealth companies. And
Hmm.
I got to tell you, there were a lot of gaps in patient privacy, a lot of patient data being shared, a lot of data being pulled out of the application. And I think startups may overlook the necessity to keep patient information private, but a good marketer, a good PR plan in the year ahead is going to consider that as a factor. I want to, just instill upon everybody to make sure that your products and solutions are keeping patient privacy in mind. And if you're doing good stuff there, if you're really protecting that information, then talk about it. Talk about it on your websites and in your content.
Yeah.
I think, John, another one and I know my colleague Erica Johansson.
Hmm.
She's part of the HITMIT community, and I know has been on some of our talks, and I think she heads up a social media group as well with you. She was always reminding me about patient voice.
Hmm.
So typically, healthcare IT companies don't think too much about the patient voice, but I do think that the media and the publications we work with, they're interested in hearing that. So if you're a health IT company that has a product or service that touches the patient, think about putting that in your mix for 23.
Hmm.
Certainly being able to capture that patient voice. And there's some creative ways to do that and include them. I think there's a lot of interest in that.
Yeah. I mean, I think it's interesting you bring up the privacy and HIPAA piece of it, because, if they don't do it right, then they're going to be hiring Finn for crisis PR rather than, promotional PR, which is a different issue, right? But I'm kind of struck by two of the things that you said, and that is, bring us the data, right? And then, find the patient's stories, which to me highlights that something that I think a lot of organizations don't understand. They go to a PR agency and they think, get us a story. And they don't realize that they have an obligation as well to provide you the stories to tell, whether it's the data points or whether it's the patient stories, because, a PR agency is only as good as the stories that are available from the company. And I think that's an important collaboration that a lot of people don't understand, right?
Oh, absolutely. John, I've been in healthcare. Let's just call my entire career, right? Call me a
Uh-huh.
healthcare geek or a healthcare nerd. I don't know.
Uh-huh.
But so I know a lot about the industry and about the processes and workflows. But, at the end of the day, I need to talk to the executives at the company. I need to talk to their customers. I need to talk to the customers' customers. And that's what we need to really get that full rounded out story and make it impactful and meaningful. Not just a piece of sales collateral. I mean, nobody wants that, right?
Yeah, and I just think that's important, for the HIPMA community to understand that you can't just turn it over. Here's my company, get us a story, right? It takes a collaboration and some work on the company's part to share what the stories are. So I think that's
Yeah.
important. How about let's shift gears to the provider side of things? What should PR people on the provider side be looking for in 2023?
So on the provider side, and you mentioned crisis control a few minutes ago. Providers are faced with a lot of potential risk. I mean, think about all the things they have going on, right?
Yeah.
They've got the staffing shortages, which of course we have in PR as well, but they've got it immensely. I mean, the labor shortage in healthcare is just at levels I've never seen. And I've talked to clinicians recently that are just ready to retire. I mean, they just can't, it's so hard. There's so much PTSD out there.
Yeah.
And just overload. Erica, actually, Johansson had a situation recently where she had to take her son to the emergency room, and they sat in the emergency room waiting for a bed for 50 hours.
Wow.
And the level of stress she saw was just unbelievable. She shared it with her story with me the other day. So labor crisis, cybersecurity. I mean, our hospitals and health systems just keep getting attacked, right? So if it hasn't hit them, it hasn't hit your facility yet, it's gonna, right? And then the last thing that I think about, so hospital margins, John, are the lowest I've seen them in my entire career. I mean, we have a lot of dire straits going on. I don't want to be so gloom and doom, but I'm sorry. I believe this crisis thing is a tough one for 23 for providers. And some providers may turn to some really more aggressive collection strategies with their patients, but I think that'd be a mistake, because then you're going to have another crisis on your hands. So I think, providers need to at least have a person in place or a partner in place or have a plan for crisis management, because I think we're going to see some in the year ahead. The other thing that I think is on the positive side that I would love to see more providers do. I was at the HLTH, Finn sponsored a summit in conjunction with UC Davis. And two of the panels that were part of that summit were panels of innovation centers at hospitals, health systems, academic medical centers. These CIOs, Chief Innovation Officer, the new CIO, excellent panels. I mean, they are doing amazing work, John. I'm so excited about what we're going to see coming out of our hospitals and health systems. That, if you're a provider that has one of those, I would say tap into that for good, positive, stories. The media would love to hear what's going on, what's being proven, back to my point about proof points, what the clinicians are loving and adopting, and what's scalable. So I would say, look for the positive stories out of your innovation centers. Also promote, any DEI, community, or environmental initiatives. The usually, providers, healthcare is local, right? And providers on their marketing and PR really need to make sure that they're sharing the values that they have as an organization with their communities. It's going to build patient trust and build patient loyalty.
Yeah, and they usually have a lot of those stories. I think you get distracted by some of the other patient stories and the provider stories. I think a lot of healthcare organizations forget about some of the diversity inclusion stuff that they do, because it often is very diverse. Or even the sustainability efforts with we just rolled out this new hospital, but often there's a lot of sustainability stories in there. That's really interesting.
Absolutely.
How about, when it comes to journalists and publications, I think it's been an interesting decade together we've been through. But do you think we'll see an increase or a decrease in publications and journalists in 2023?
That's a tough one. I was thinking about my answer to that question, John. And
the crystal ball's a little big. It's a little foggy.
Well, actually, I thought about both, right? Decrease and increase. But I think about the 12 years that I've known you. We have not really lost a lot of publications. We've actually gained more than we've lost, right? In that past 12 years. So I think that if we see a decrease, we may see a decrease. Staffing is a challenge. We met with some media in Boston 2 weeks ago, and staffing. I mean, just like everybody else, they cannot find the writers. They cannot find the journalists to cover the stories. I mean, that's another tip actually for your audience, is they are looking for more contributed, curated content, as long as it's really good, right? Research-based, thought leadership stuff. But they're having trouble, feeding that content engine. So there may be some that just can't keep up. What I see the decrease, really, I see sort of maybe some consolidation.
Mm,
I could see a few consolidation points between now and the end of 23 happening. But then the other side of the coin, and why I say it's both, I think we're also going to see an increase.
mm,
We work with a lot of really senior, knowledgeable journalists in healthcare. They really know healthcare
mhm.
really, really well. I wouldn't be surprised if a few hang out their own shingle and sort of
Really
start their own channels,
interesting.
whether it's, a social channel type thing, or, a YouTube channel, or something. I actually kind of see an opportunity for that. And I think there'll be more opportunity, maybe even, and what I expect to see is more contributed content on places like LinkedIn and Medium and sort of some of those other channels.
Yeah. Well, it's so easy to publish content now, right? I mean,
Mm.
even when I started 16 years ago, no one knew what a blog was, and then blogs made it easy, but now social media has made it even easier with the newsletter ones, etc. So, it's a good point, right? And you can build an audience easier in a lot of ways too.
And
Well,
actually, the other
go ahead.
increase I see is maybe some more creativity in like
Okay.
how they collaborate with the health IT companies that are members of
Mhm.
HITMIC, but also with us agencies. I think there's going to be some interesting creative collaborations.
Oh, who's going to be the breakout TikTok health IT professional? Is that probably more so on the healthcare side than the health IT side, I think.
Yeah, exactly.
Cool. Well, as we kind of wrap up,
Yeah.
what do you think will be the biggest PR and marketing story in 2023?
Wow. Well, I had three thoughts about that. If we
Oh,
have
so there's going to be
time,
three stories. I got you.
there's going to be
Okay.
three. um, I heard something over and over again at Health, and that was that disruptors, innovators need to partner with incumbent vendors. So
Hmm.
what I hope to see is more stories about some of the new startup digital health technology that's out there, but it actually integrating with Epics and Cerners and some of the existing systems. Like, for example, when I was at Health, I met with three different virtual care companies. It's totally different ones.
Mhm.
And all three of them were built on the Epic platform. So
Wow.
I'm really looking forward to sort of seeing that more collaboration, because hospitals and health systems, John, we've been doing this for a long time. They have put so much into their infrastructures, and we need to make sure that all of our new disruptive technologies that we're pursuing, they play nice in the sandbox with what we already have, right? So we can make sure we're not losing any of that investment.
Yeah.
So that's one. I'd like to see
Okay.
that
The
covered more.
second.
Um, and this kind of is a piggyback off of that one. So the terms, right? The terms we use. So your channel is health IT. HIMIC is the health IT marketing. We have lots of publications in our industry that are health IT, but then now we have this whole wave of ones that use the term digital health. So I am hoping that smart folks like you in our industry can figure out how to connect the two, because at the end of the day, it's all about using all the new technology and tools we have available, all the new and innovative um, tools, I guess is the best word I can use, and tech to drive healthcare to a better place. And,
Yeah.
I think bringing those two vernaculars together is important.
But we could just embrace one term, healthcare.
We could do that.
Well, it doesn't
Do
matter
that.
if it's digital, it doesn't matter if it's technology, it's just care, right? It's
That's
care we
right. Let's
can-
just make care better, right? However we do
Exactly.
that. The only other thing, I don't know, this is, my peers at Finn, as you know, Gil and Fern and some of the others, Erica, we all talk about this from time to time. Whenever a big, huge brand makes a big healthcare announcement that they're going to
Uh-huh.
jump in with both feet, I'm the skeptic, right? I've been in this industry, wow, since before DRG, so that's a long time.
Uh-huh.
And I have seen so many big brands come in and then go out. I've worked for a few, as a matter of fact.
Mhm.
I don't know. I think we'll see a couple more of the big brands that have made announcements over the past year or two kind of back out,
Mm.
or sell their investments, or I don't know. I wanted to be positive about that one. Like, I wanted to say, oh, we'll see them make great strides, but healthcare is a complex business. It's not a consumer industry, and it has a lot of regulation. So
Yeah.
I have a feeling, as much as healthcare appears to everyone to be sort of this enticing, exciting industry to be in, it comes with a lot of mazes to navigate.
Well, and I think that's an opportunity for startups, right? The big companies are going to, pull back if they're not seeing the results that they need to, and they have to go bigger than a startup can. And the startups have, it's like everything in life. Is it an opportunity or is it a challenge? And often it's both.
Correct. Yeah, I think some of the big consumer brands, they get into healthcare thinking there will be a big financial windfall.
Mhm,
And I think at the end of the day, healthcare is very much a humanistic industry.
mhm.
Um, it's sort of that philosophical hurdle for a lot of the big consumer brands to overcome, is that we may not make as much money as we thought, but we're going to be helping the world, right? We're
Yeah,
going to be taking better care of patients.
yeah, it's a great point. Well, Beth, I appreciate you taking time to share these insights and perspectives. It's going to be fun to see this all come to fruition. And I appreciate all your support throughout the years. And of course, Finn Partners' support of the HITMIC community. I want to thank everyone for watching and listening. If you want to find more great healthcare marketing content like this, be sure to check it out at hitmic.com. Thanks, Beth.
Absolutely. Thank you, John.